The article first explains the prevalence of atopic dermatitis by looking into each demographic groups and population. The article explains that atopic dermatitis is most common in children and less in adults. It is hard to study adults because of all the different types of dermatitis that they could have. The article then talks about the impact of atopic dermatitis on patients. Healthcare professionals frequently discount atopic dermatitis, regarding it as a minor skin problem. Individuals with atopic dermatitis, or AD, are affected by both the condition itself and by stigma associated by its visibility. People with AD report lower quality of life and higher distress levels. Adults and children with AD are at risk of psychological difficulties. Many reported feeling frustrated or embarrassed. AD also impacts family lives. Families of children with AD report a lower quality of life, and this positively correlates with the severity of the disease in the patient that has it in the family. Parents reported high stress levels due to their child having atopic dermatitis. AD family impacts included sleep issues, time management issues, lifestyle changes, treatment issues, social impact, etc. Financial costs of treatment also affect the quality of life of families, since treatments aren't very cheap for people with atopic dermatitis. Because AD is not life-threatening, families do not receive enough education or support, which results in more frustration and distress. These factors led the authors to find ways to reduce the burden of AD. Their methods include the methods use samples of educational programs that provided support for patients and families. One controlled study studied the effects of parents that had received education compared to ones that didn't. So there were parents of children with atopic dermatitis that got a 2-hour session of an educational course for 2 months, to a controlled group of parents who received no course and only a routine information from a physician. The results: after 2 months, the children of parents receiving the course experienced a better quality of life, demonstrating the educational programs are useful. All in all, atopic dermatitis is a disease of increasing prevalence that can cause significant negativity in the quality of life of patients suffering, and parents and family in general. The impact of the condition is difficult on the family and an economical burden. Targeting parents and caregivers with education and psychological support may decrease the burden of atopic dermatitis. This in turn may decrease the cost of AD to society through the medical, psychological, and family outcomes. Basically, what this article has to do with my topic is it talks about the different factors that cause a burden, that atopic dermatitis causes a burden on, and how it lowers the quality of life for not only the patients but the families, and a little bit on the stigma associated with atopic dermatitis, which is part of my topic.